Okay. Well, good afternoon, everybody.
Good afternoon.
How are y'all doing today? It's beautiful out. It was like 60 degrees yesterday. I don't know what it is out there, but it's pretty nice. All right, so we asked everybody to come together because we thought it was important that we meet with all the residents and kind of talk about, you know, what's going on in the news today, and that's the coronavirus, or how it is more commonly, well, it's more commonly known as the coronavirus, but it's the coronavirus, but it is the COVID-19 virus strain specifically. So it's catching a lot of hype in the media. You can't go anywhere and not hear about it and not see it. If you have an actual need for a surgical gown or mask or cap or booties, good luck getting them, because even Amazon's running out of them right now. So there's a lot of myths, a lot of misconceptions, and a lot of anxiety about it. So what we thought would be a good idea is to bring everybody in and kind of talk through it. We are addressing on our end everything from policies, procedures, and following up on the CDC recommendations. So the Center for Disease Control puts out recommendations, and then Centers for Medicare Services, CMS, that's another governing body that we report to, they basically say, see CDC guidelines. So that's kind of how it works. So the team I have up here with me is Diana Wilson, she's our Director of Nursing, Danielle Macias, she's the ADON of Healthcare, Carrie Wooten's the ADON of AL, and Tanya Blumenshine. Now the last time Tanya was in front of you, she was the AIT, but as of Saturday, Tanya has passed her board, so almost officially. She hasn't gotten the piece of paper in the mail, but Tanya is now a licensed nursing home administrator. So if we take a second to congratulate her. So they're here to help me answer questions when we're all done, because I have a feeling we're going to answer some questions and we're going to talk about this, and then we're going to end up with more questions on an individual basis after. So my goal was to bring in some representative from nursing to kind of help talk you through some things. So what's important to know about the coronavirus? Well, the CDC basically is treating it like any other respiratory virus. In other words, from a prevention standpoint, it's no different than what you would do against the flu, the common cold, or anything else. So the CDC put out some postings for us to hey, and these are not revolutionary. This is actually basic infection control 101. We didn't have to change a single policy or procedure when it comes to this. So how can you help ward off the coronavirus? Well, stop the spread of germs. This one's kind of a no-brainer, but I guess that should go without saying. Avoid close contact with people who are sick. So if you have a friend who's sick in the hospital, call them, wish them luck, send them a text, Snapchat them, something. Don't go to the hospital. Where's the highest concentration of sick people? Hospital. If you don't have to go there, I would avoid it. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. And I'm going to ask that you actually make it in the trash can, because I spend a lot of time picking tissues up off the ground. Avoid touching your eyes, nose, and mouth. So don't play with your face. You know, keep your hands clean. Which is next? Oh no, it's down here. Clean and disinfect frequently touched objects or surfaces. So Lysol, Clorox wipes, things that kill 99.9% of the viruses and that, you want to go ahead and just wipe things down, and you can do it more frequently than you would normally do it. I suggest door handles, anything like that that gets touched frequently, especially by outside visitors. You want to make sure you wipe them down. Stay home when you are sick, except to get medical care. So if you're not feeling good, and I'm calling a meeting about COVID-19 and you're having respiratory issues, stay home, because you don't want to be the example. You don't want to be patient zero at SMC. So you want to stay home. And then this last one is wash your hands often with soap and water for at least 20 seconds. So we used to train people to sing happy birthday to themselves when they wash their hands, right? Any old nurses in here? You remember that? You wash your hands and sing happy birthday? You want to make sure you're using a good antibacterial soap, and you want to wash your hands for 20 seconds. And you want to frequently wash your hands, especially if you've gone out to a public place or whatnot. Wash your hands. Carry hand sanitizer. Purell is the highest alcohol content hand sanitizer that you can get. Now, whether or not you can get it right now is another story, but Purell is the best hand sanitizer to use, or anything that's above like 90-some% is about as high as you can get it right now. But washing your hands is the #1 defense against basically all respiratory viruses. One of the things that the CDC has put out is that you see a lot of people wearing surgical masks. It's not saving you from anything. You need what's called an N95 charcoal filter respirator to actually stop the virus from penetrating. They're about $1,800 a piece. So most people don't own those, but that's what you need to actually stop any viruses from penetrating. That filter, that coffee filter you're putting on your face, isn't going to stop viruses from coming in. So what it does help is when somebody's coughing, it's containing their bodily secretions from coming out. And it's going to stop you, I guess, from getting spit in the mouth, but you're not protecting yourself from the airborne virus. So stop germs by washing your hands. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the back of your hands, between your fingers, and under your nails. So a lot of people don't think about that when they're washing their hands, but you should try to get underneath your nails, especially like if you've just come from like eating chicken wings. You get that stuff all up underneath there, and then you're touching door handles and that when you're coming out. You have all that extra stuff underneath your nails that can pick up those viruses. So then, yep, did that? Nope. Scrub your hands for at least 20 seconds. Need a timer? Hum happy birthday. See? I actually didn't even know that was on there. How about that? From beginning to end twice. So rinse your hands well under clean running water, and then dry your hands using a clean towel or air dry them. So we'll talk about towels. How many of you have a hand towel in your bathroom? How often do you change it? Okay, that's better than me. So they recommend using paper. That way, use like a paper towel, dry your hands, throw it away. One of the things that they're really recommending is that you don't leave like wet towels and that sitting out, because if you did wash your hand with the virus and it's on the wet towel, I don't know if there's any scientific proof to it, but they're saying that's not good. So just use something that's disposable and throw it away. Outside of that, there's really not much to it. If you have somebody or know somebody who's traveled outside the country in the last 30 days, I probably would not go see them right now. That's one of the biggest things that they're having people ask about is like when we're bringing someone to the campus, we have to ask them if they've traveled or if they've been in contact with someone who's traveled. What's the third question? Traveled? They've had contact, or if they've come in contact with somebody who was diagnosed with COVID-19. Now in Ohio, we have 10 people I think at last count I saw under observation, but all 10 have tested negative for COVID-19. So right now we don't have any active cases, but if any one of your family or friends has traveled internationally or been at an international airport, I wouldn't rush over and shake their hand. Oh, that's another thing. When you're in social situations, they say a fist bump or an elbow bump, but not shaking hands. That helps. Just reduce the contact. That I had something else there for a minute and I lost it. But Bill, you rose your hand.
What about mail that we receive from other countries, especially China?
So I've not actually seen anything about mail or anything like that, but that actually is a good question. Because if you order anything on Amazon, a large portion of it comes from China, depending on what you're getting. But anything that comes in the mail, I would probably just wipe down and disinfect. If you order like clothing or something like that, I'd probably just wash them right away. in normal wash cycles. But I've not seen any actual recommendations on how to handle mail. Because, I mean, the truth is for everything that's going on with the coronavirus, the CDC is basically putting stuff out, not so much about how, and I guess I'll make this clear, what the CDC is putting out for us to follow is more about how to handle the situation of when there is somebody who we suspect or has been diagnosed with COVID-19. As far as the standard operating procedures of day-to-day living, it's no different. They are not telling us to change everything that we're doing. They're telling us to just follow basic infection control prevention 101. But should you have somebody you suspect, now they're giving us some guidelines, what do you think the first guideline is?
Wash your hands.
Wash your hands and keep them isolated until you can get them tested and cleared. Then the second thing is if you do have somebody who has been, they tell you how to isolate them, which I'll just be very upfront. We cannot isolate somebody who has been diagnosed with COVID-19 because we do not have a negative pressure room. That's not something nursing homes usually readily have available. So there's very strict guidelines on how those people need to be quarantined, and we don't have those types of rooms here. We don't do that kind of care.
So what do you do?
Ship them out to the hospital, and the hospital has a very limited number of rooms they have for that as well.
How about visitors? Are you allowed to have a visitor or not?
Yes, we do allow visitors. Now, the other sign that I have up here is a sign that we had made up, and it's asking all guests, in order to help us keep all of our residents and staff safe and healthy, please refrain from visiting your loved one if you have traveled outside the U.S. in the last 3 months, have been in contact with anyone who has, or if you are experiencing any of the following symptoms: fever, chills, cough, achiness, shortness of breath, difficulty breathing, or any other flu-like symptoms. So we posted these up at the entrances. These boards specifically, because we ended up getting to the point where our front doors are nothing but tape. So we're making boards up that are going to sit in every entrance to make it a lot easier. It draws people attention to it more than just posting it on the door, because there's stuff posted on those doors all the time. So we thought we'd draw a little more attention to it and make some boards up. So these are going to be placed out there. If you have visitors coming and you know they're coming, you may just want to ask them and make sure that they're feeling good. And again, that's true from the flu as well. If someone's exhibiting flu-like symptoms, whether Corona was out this year or not, I probably wouldn't be inviting them over to my house, because the flu is pretty bad, pretty nasty, and it's a little more lethal than Corona is at this point as far as effect, or whatever the term is. What? Infectious. Infectious. We'll go with that.
How about little children who always have colds? You've got to watch.
Yeah, you have to watch. So one of the number one defenses, aside from infection control, is being healthy, right? When your immune system is compromised, that makes you easier for you to catch just about any virus or illness. So I was actually forwarded an email today. Bill Selsum shared with me an email that he received as part of the Shriners. Okay, you just sent it to me, Bill. It should be near the top. Here it is. One of them is a physician, and he sent out a message about different things that they can do. So, I zoomed in too far. Be sure you're taking at least. Sorry, I skipped one. Technology's not on my side. This physician's recommending to take liposomal vitamin C, comes in 1,000 or 1,200 milligrams twice daily, increase to 4 or 5 more daily if you feel like you're coming down with something. It's much better and worth the slightly higher price. Liposomal gets blood levels similar to IV vitamin C. Be sure to be taking at least 60 milligrams of selenium daily. Take at least 70 milligrams of zinc. It should be in your multivitamin. Zinc lozenges are available at your local pharmacy. It kills viruses in your throat on contact. Use them if you feel any inkling you might be coming down with something or might have been exposed. The only side effect of too much zinc is nausea and vomiting.
What about your lunch?
Well, I don't know. Take vitamin D3, at least 5,000 international units daily. You can have your blood level checked. It should be above 50. Some experts are now saying above 80. I need to take 10,000 a day to keep mine at 55. Oh, here you go. A mask won't help you from getting the coronavirus, but it will keep you from touching your face. Coronavirus is spread by droplets and coughs and sneezes. The viruses can live on surfaces for 9 days. So there you go, Bill. If you got it overnighted, that'd be a problem. But if it came through snail mail from China, it might have taken 9 days to get there. Don't touch anything you don't have to, including other people. Fist bump instead of shaking hands. Use your knuckle or elbow to press buttons. And use disposable exam-type gloves at the last resort. If you cough or sneeze, do it into the tissue and throw it away, or into the side of your elbow. So there you go. He recommended carrying a box of disposable gloves for when you do things like pump gas, right? Because you go to a gas pump, how many people have touched that gas pump prior? You could carry Clorox wipes, you could carry Lysol. I don't know if I would carry Lysol spray with me, because when you spray that, some people may get offended. But you could keep small packs of Clorox wipes in your pocket or your purse, and you can kind of wipe things down. But again, it's all pretty basic infection control prevention. So it's just being smart and thinking through, what you're doing. We are trying to get more alcohol-based no-touch dispensers ordered in. So the ones that you just put your hand under and then it dispenses. We're trying to get more of those in so we can put more up around the campus. But other than that, we really don't have much to share or say, because that's kind of it. Just want to educate you guys on what you can do to help stop the spread of any virus, not just coronavirus. And then also tell you that if you're feeling ill and you feel like you may be getting the flu, that you can get a test. So last week we were told the Clark County Health Department actually has coronavirus tests available, but then I heard something over the weekend that local pharmacies are starting. Did you guys hear that? That they're starting to get test kits. But I know for a fact you can go to the health department. So if you're feeling like you may be coming down with the flu, you can go to your physician, and then I believe they can swab for the test and send it to the health department. But if you're not feeling well, stay home, take care of yourself, and contact your medical provider. What you got? See, wet ones, there you go. Now, wet ones may be more like a hand wipe, correct?
99.
Okay, well, there you go.
I wipe down every place I go. You're all clean now.
What about those with prone pneumonia all the time?
If you have a compromised immune system, I would recommend avoiding crowded areas, and I would pay extra close attention to things I'm coming in contact with. And again, stay up on the vitamin C, stay up on those things, and just try to stay healthy. If you have like chronic lung disorders, or you have just a compromised immune system, your best defense is eliminating exposure. Bill?
Are we being more careful and who gets into Pathways area and the other hospital areas? Should they be contacting the nurses section there to see if they can come in?
Well, we're not quite there yet, but we do, like I said, we do have the signs up. We do talk to the visitors and ask that if they have been out of town or they're feeling ill, not to come in. But we're not at a point where we want to restrict like all visitors, but we definitely want visitors to self-identify them as being a potential issue and then not coming in.
How about us going out? Can we still go to Walmart's and Myers and places like that? Because
Yes.
That's big crowd.
Yeah, no, we're still going to offer transportation to go to the stores and stuff like that. You just want to use your best judgment on whether or not you're in a health. I am struggling with my words today. If you are compromised and should be exposed to that, that's going to be totally up to your decision. Danita.
Housekeeping, are they going to kind of double up on doorknobs, elevators, stuff like that?
So so what her question was, is housekeeping going to do more doorknobs and handrails and stuff like that? The answer is yes. We are cleaning those more commonly touched areas more frequently. Some of the buildings, obviously, you know, like in this building, there's so many people coming through. One of the things that I'm also looking into is I go to a local grocery store that has a tub of Clorox wipes about the size of a trash can, and it sits on a dispenser. We're looking to see if we could put things like that out and around just so other people can help wipe down areas that they've touched. But yeah, housekeeping is hitting the handrails and the doorknobs, buttons in the elevators, and the handicap buttons. They're hitting those more frequently. Cool.
Where's the public health department?
I actually don't know. Do you guys know where the health department is?
Home Road.
Who?
Home Road.
Oh, on Home Road, by the high school?
By the high school, yeah.
By the high school. All right, well, I don't really have anything else to say. Do you guys have any more questions about Corona? And not the one you gotta pop the top on?
What is the nurse's position as far as helping the residents out? I mean, if I feel sick and I don't feel like moving or something, can I contact the nurse's station or what? I'm new here, so I'm...
You're new here?
He's IL.
Because they have.
He's an IO. You want me to take it?
Yeah, they have the
Clinic.
clinic, right?
Yeah.
Who's the doctor?
Dean.
Dr. Dean is in the clinic?
Well, I've been to the clinic.
Okay,
So
so
just
if you show any
contact-
signs and you feel like you're becoming ill with any of those symptoms, then I would suggest you make an appointment and get to them right away, or go to the hospital, or you can even go
I
to
don't
the
wanna
health
go
department.
there.
I know. Well, I mean, to the emergency room, you know, if you're feeling that poorly.
Yeah. Okay,
Something
contact
else?
them.
Yeah, right away. You know, if you know somebody that's coming to visit you that feels ill, then I would tell them to stay out of the building. Anything you can do, if we can get those wipes out, just grab them and wipe, you know, what you're going to touch, wipe it down. Your walkers, your wheelchairs, anybody that might come in contact with it. Hand sanitizer, a good idea. When you have your little bottle of hand sanitizer, make sure you're washing the tips of your fingers. You do the palms, that's great, but make sure you hit every part of your hand, so you're not missing anything of the surface like you would when you're washing your hands with soap and water. You can do that often. Use that often and carry that with you.
Hand sanitizer 5 times wash.
Oh, okay. Well, what we typically tell our staff is you can use hand sanitizer 5 times before you wash with soap and water. So at least 5 times whenever you come into contact with something, before you go to the sink and use actual soap and water and towels. Okay? Any other questions?
Yeah, I don't think you answered his question. He's new on campus.
Okay, well,
What does he
do you know where the
do?
wellness center is?
Yeah.
Okay, the doctor's office, what's their hours, do you know? The doctor's office, the clinic is down there right by the doctor, or by the wellness
Monday,
center.
Tuesday, Friday. They're open right now, 1 to 5.
1 to 5, Monday, Tuesday, Friday.
Otherwise, they used to call the office.
Oh, otherwise, you can call the number and call the office to get an appointment. Okay? Sorry, sir.
8 to noon tomorrow and 9 to 11 on Friday.
8 to noon tomorrow, 9 to 11 on Friday.
Yeah. Dorothy, I think what you're asking is, because he asked, can he contact the nurses? Is that what you're saying?
No, he's here new.
Yeah, so.
Who do I call? I get the
Well,
operator?
if you're an IL, you want to call your family physician. So if you're an AL, you want to contact, so if you live in Cunningham or you live in York, right, and you don't feel good, you want to tell your nurse to start, and then the nurse will contact your physician. If you live in Scottish Rite or in the Villas and you're not feeling well, you want to contact your family physician, which if it's Dr. Dean down in the clinic, or if it's, you know, Dr. Smith out in the public. So the nursing staff that we employ, they can only work inside the licensed areas because that's how our license works. So they can't like come take care of you in the villa. If you need that, then we can get home health. That's the word I'm looking for, home health. We can contact Ohio Living and have them come out. Our licensure only allows us to practice medicine for the residents housed inside the licensed areas. So if you're an IL, then we have to rely on home health to help.
I saw an example of a TV remote that was, you wouldn't want to touch it.
Was it at your house?
No, it wasn't.
Yeah, public anything right
Maybe
now,
help
I would just
somebody
wipe
out
down.
sometimes.
Yep.
Tony, any suggestions what we should do about the boutique with the amount of different clothes coming in? And we've gotten some really, I'm asking the residents, if you're gonna bring clothes, please bring
Yes.
good, clean clothes.
So Barbara's question was about, the boutique and how to handle the clothes with everything going on. I'll be very honest, and I know you probably don't want to hear this, but
I know,
and I said Barbara, it's Brenda. I would not accept any clothing right now.
So you think maybe I should just lay low for a while?
I would. I would just,
Debbie was very-
just to be better safe than sorry, unless you're gonna bring them in and wash them immediately, I wouldn't harbor anything. I would hold off for right now.
Debbie, that's why I'm here today. Debbie was very concerned about it too. And so I told her I would ask you or Dave what you felt we should do because we
Yeah,
are getting such a turnover.
I would just hold off. And like I said, unless you can bring them in and immediately wash them and get them clean.
Or keep them somewhere.
Yeah.
For a month, the time.
Or harbor them somewhere for a few weeks to get it past that time
So
frame.
like what we got, just keep it closed for a while and
Mhm.
then maybe say the end of April, go back into it or,
Yeah, that's probably not a bad idea.
because she's thinking about canceling her trip to Arizona. So,
Well, right now, they're not, there's travel advisories on, but it's to very specific areas, and basically right now, what they're trying to stress is practice safe infection control and just be careful, but there's no immediate need unless you are around someone who has it. Like the coronavirus isn't sitting on this table waiting for someone to come by and get it. Somebody has to be infected with it for you to contact it. So if you're not in a hotbed or you're not in an area that's had any cases, just practice these techniques, and then at least if somebody you were to come in contact with, you're limiting your exposure.
What's the life cycle of that virus? How long does it last? You know?
Honestly, I do not know. The one thing that so we get 32,000 emails a day about coronavirus now, but the one thing I've not read is actually what people go through with it, other than its flu-like symptoms.
They can show it between 2 and 14 days.
Yeah, and it
After
shows up between
exposure.
2 and 14 days after exposure.
If it's on a flat surface, how long, how long?
9 days.
9 days.
Yep.
is that the same as on clothes? If it's on clothes, same?
Mhm.
See it?
So just 9 days.
And if you think about it when you're out and about, you got a bubble, okay? Kind of like when you're walking around. If you're within 6 feet of people that are coughing, step back. Because, it travels, but you might have that 6 feet radius around you like you're in a big old bubble just to kind of mind the people you're around. That's why they're canceling, basketball games and not suggesting group activities, things like that, in that vast amount, so you're not spreading things around and sharing it with everybody else.
Are we still having coffee connection for?
We called y'all together here.
If you know of each other, anybody that's ill, that they can't, speak up for themselves, or they've been stuck in their apartments, do let us know so we can get some help to them.
Who do we let to know?
Contact Dave.
It depends on where you live.
Yes.
Just to go along with my other question about housekeeping, can we make sure the dining room kind of doubles up and wipes chairs and stuff?
Yeah, we actually talked about maybe even doing away with the linen napkins. We even talked about maybe doing away with the linen napkins and going to more of a disposable napkin for a while, just so we're not balling things up and things are just going into a trash. So if you see that, it's not a budget cut, because trust me, that ain't cheaper, but we may be doing that here this week, moving to a disposable napkin instead of the linens.
What tablecloths?
We'll probably eliminate the tablecloths, because then, even though those are able to be, well, no, those ones are cloth, I think of the other ones. Yeah, we'll probably just eliminate the tablecloths. Because that way we don't have to turn them over, and we'll just, that, we can terminally clean the table itself. All right, well, if there are no more questions, it's getting warm in here.
Best advice I heard on washing your hands, wash it like you just touched a Michigan jersey.
There you go. So this morning I heard this rumor that the NBA had talked about doing basketball games without fans in the stands. And they questioned LeBron James, and he said, well, if there's no fans in the stands, I'm not going to play. I play for the fans. I'm not going to go out there and play with nobody in the stands. And then the DJ said, I don't know what the big concern is Bengals have been playing without fans in the stands for years. See, I'm a Browns fan. Even when we're bad, we pack the stands.
Yeah.
All right. Well, thank you, everybody. Up north.